Ariel or Ariel? I'm sorry if I said it wrong. Good morning, Vanessa. It's a cold morning here. It's about -12. Thank you, Ariel. I'm glad to say that. I'm happy to share infection control. It's, being an esthetician, being an old broad, it's been a passion of mine for quite a long time. So I'm happy to share it. Next webinar will be really, really interesting because it's something that we're all supposed to be doing, but none of us are. So it's kind of an in-depth webinar. This one will be short and sweet today. All right, everybody, let's see here. Oh, okay, Ariel, if you can send me email to, actually, just leave your email. No, you don't want to do that. Send an email to me at CAT at CBONgroup.com. I will make sure you get the link. But the links are also on our website, infectioncontroleducation.com. So you should be able to get the link from there as well. Good morning. All right, everybody, we're just going to give it a minute or two and let everybody sign in. Hi, Fatima, Shannon, Lori. Hi, everybody. Good morning. I know it's not morning probably where everybody is. It's 9 a.m. here, so I'm sure it's 12 p.m. in the eastern areas of the country. Good morning, Kamal. Tamara, good morning. Yeah, it's cold and frosty here. Cold and frosty. So maybe we'll begin. This morning, instead of a Q&A, which of course you're welcome anytime to ask any questions you choose to ask, and I will answer them to the best of my ability. And if not in this chat, then certainly I'll respond to them after I get the chat record. We're going to talk about the company who actually brought accelerated hydrogen peroxide to the Canadian market for disinfectants. I just want to welcome you all for attending today, and I'm excited to let you learn about the company that creates PREempt. All right, any questions? Just put them in the chat box. I'll do my best to pay attention and get to it. This will be a little bit shorter today. So let's talk Virox. Who is Virox Technologies? We know about PREempt, but do we know who makes it? Virox Technologies was founded in 1998 in Oakville, Ontario, Canada. There you go, you guys. Our company, our technology, our approach to infection prevention is deliberately different, intentionally not like others, truly innovative, effective, and sustainable. That is the quote from Randy Pilon, President and CEO of Virox Technologies. Virox's patented formulations are not just alternatives to current disinfectants. They're game-changing technologies. Some types of disinfectant chemistries that contain phenols, alcohols, quats, chlorine, etc., have been rendered ineffective as the pathogens they were designed to kill have become resistant to them. So everybody's heard about superbugs, and a lot of the superbugs were created not just from their inability to be killed by antibiotics, but they were created because these disinfectants began to fail and the bugs began to get stronger. Come on, let's see what the next one is. Over time, these disinfectant chemistries also began to threaten our personal health, our safety, and poison our planet. You have all heard of VOCs. You hear me talk about VOCs, volatile organic compounds, and they absolutely were in all these old chemistries. So Virox Technologies took matters into their own hands and created disinfectant chemistries that are deliberately different, intentionally not like others, truly innovative, effective, and sustainable. You could say they created a new generation of disinfectants for the war against microbes. They also included a new standard of performance that did not compromise on efficacy, personal safety, or environmental integrity. They created products that are unmatched in efficacy with safety of use. And they're manufactured by a company dedicated to rigid quality control standards, rigorous inspection of incoming raw materials, ongoing employee training programs, enhanced manufacturing procedures, and ongoing testing of finished products. Virox was the first chemical company capable of attaining the Ecologo UL by developing green certified products. Now, I don't know if any of you know what the Ecologo is, but these products are verified for reduced environmental impact. This is a really difficult thing to attain. Ecologo certifications are voluntary. They're multi-attributed, life cycle-based environmental certifications that indicate a product has undergone rigorous scientific testing and exhaustive auditing to prove its compliance with stringent third-party environmental standards. Now, as a distributor, I used to carry a known BC skincare that had seaweed based. And she also was Ecologo certified. And it's not just that they say, oh, we're going to certify your product. You have to audit and submit hundreds and hundreds and hundreds of documents to prove that your product deserves this. And it costs the company thousands and thousands and thousands of dollars to do it. So really, we don't pay enough attention to the Ecologo, but it's a really important thing to notice because that means that the company who carries that logo has vested and invested in their product, and it's been scientifically tested and audited. These products are also manufactured in a LEED Gold certified facility. Now, I had never heard of a LEED facility. It's an acronym that's short for Leadership in Energy and Environmental Design. LEED Gold buildings are second highest certification for green sustainability. LEED certification is a mark of quality and achievement in a green building. I didn't know this, and there's many levels of LEED. The next one up is platinum, and that would probably be for, I don't even know what company carries the platinum, and I guess I should have done my research and checked for you, but I had never heard of a LEED green building. It's US certified, and it's another really interesting thing to carry. Virox Technologies holds establishment licenses with Health Canada, the Environmental Protection Agency in the US, and the Federal Drug Administration, which is the FDA in the USA. All of these are not easy to attain. I'm not sure if you know, but Health Canada validates every product that comes into the country. When you import a product, it doesn't matter what product it is, it has to pass through Health Canada that it's safe to use. And they're not easy to attain. The Environmental Protection Agency is just as difficult because they have so many products. Yours doesn't mean anything to them unless, it has a certain quality to it that they appreciate. As specialists in disinfectant chemistries, microbiology, environmental cleaning and disinfection, facility assessments, and policy and procedure development, Virox is dedicated to achieving best practices when it comes to infection prevention. Virox products are endorsed by third-party authorities, the scientific community, government regulatory bodies, key opinion leaders in a broad range of industries. And here's some of them. Even the Australian government certifies Virox. It's important that as a company or an individual that's using products, you are able to have faith in these, because these products protect you, your family, because what you get at work, you can take home. And it's important that you protect your clients. And it's important that you educate your clients on the quality of the products that you use on them. That will help build faith with your clients, and they will continue to come to you for good reason, because you care about what you use. Always, always educate your client, especially on disinfection, because they really don't know. They really don't know. So the more that we can explain to them and share with them, the more secure they feel, because they then won't bring home anything to their families. And that's important. We all know about the foot fungus debacle. So this is who Virox is. Virox is accelerated hydrogen peroxide, or AHP, is the world's first and only disinfectant technology that is safe for use on your hands, on surfaces, and devices. Now, when I say that, we're not talking about HLD5 or CS20. Of course, those should never, ever be touched, because they are created to kill any living thing that's on them. So that includes our skin cells. So please never, ever, ever touch HLD5 or CS20 with your bare hands or skin. That will do nothing but harm. I've had texts when this product first came out. I had estheticians call me and say, I'm never using this product again. I can't touch it. It burns me. Well, you're not supposed to touch it. Yes, it will give you a bit of a burn because it's supposed to. But it's safe. If you use RTU or wipes or even concentrate and you get it on your skin, it's not going to harm you, and it's not going to give you contact dermatitis. So you need to, yes, of course, always wash your hands with soap and water, rinse and dry after you use any chemical product. But with accelerated hydrogen peroxide, you're not going to get the effects that some chemicals will do. Even hair color, you can get really bad contact dermatitis from. I know some hairdressers who can't even walk into a hair salon to this day, because it's not just contact dermatitis on your skin, it's contact dermatitis or VOC reaction in your lungs. And the minute you smell that, your allergic reaction pipes up and they go into not quite anaphylactic shock, but they have severe breathing problems. So that's why using this product is so wonderful for us as technicians, because we use it tens and 20 times a day, making sure that everything is clean and safe for our clients. So we want to make sure that we are covered. Virox Technologies AHP brands have grown to partner and serve with many markets across the globe. So PREempt is one. It used to be Excel. There's Coltine, Cycan, PeroxyGuard, Shield, Diversey. Everybody's heard of Diversey. Restorox, and Rejuvenate in the US. In the US, Rejuvenate is PREempt's twin sister. However, because in the US, Virox is dealing with the EPA and the FDA as opposed to Health Canada, everything on those labels is different than it is in Canada, but it's still the same product. Virox works with industrial and institutional healthcare, medical sciences, dentistry, medical device processing, which I'm not sure if you know is a completely different industry, veterinarians, mold remediation companies, comparative medicine. Comparative medicine is the field of study which concentrates on similarities and differences between veterinary medicine and human medicine. Sorry, I just thought I would clarify that. So it's the difference between human and animal. International space, aviation, medical cannabis companies, clean rooms, and critical environments, including the professional beauty industry. If you are ever in need, please go to viroxprobeauty.ca. All the protocols, all the reference sheets, anything you need is there. And if you have a question, you can always ask Virox. Of course, you can always ask Chrissy as well. Chrissy's really good at, she's been in infection control since 2012, I think. So if you can't get me, Chrissy's always a really good one to reach out to. So now you know all about the Canadian company that manufactures PREempt and oh, so many other disinfection products. Virox keeps you, your staff, your students, your clients, and ultimately your families safe. So that's who Virox is. Those 4 letters. Virox is safe. Any questions? I promised you a short little Q&A today. If you have any questions, please let me know. You can always type them in the chat. I'm happy to answer any questions regarding infection control, not just about PREempt. As you know, this is our baby. Here's my email address, infectioncontrol@cbongroup.com. Our website is infectioncontroleducation.com. That's where you can sign up for all of our infection control education that is free of charge. It's CBON has invested a goodly sum of money, let me tell you, to have all of these programs written, and I'm the one that wrote them. And it took me over a year, or almost a year. So the fundamental program is very in-depth. It's a lot of reading, but it's really important that that is your basic foundation for infection control. There's other modules that you can take. It's up to you. And some of them are not perfect because we were trying to hurry and get everything up, but they're pretty good. And they'll walk you through a day in the life of a nail technician, a day in the life of a makeup artist, a day in the life of a hairdresser, a tattoo artist, just so that you have an idea. Especially for students, it's a good idea of what you're going to face when you actually leave school and get out there, because nobody ever really touches on that. They don't tell you how you go to school and you're in this warm environment, and then you leave and you're by yourself and you have to figure a whole bunch of things out. So if that's you and you feel like you need questions answered, I think that we can maybe try to form a group, and maybe a Facebook group, and I'll see what I can do if any of you are interested, so that we can answer questions and going forward. And you guys can share your stories and we can see what's really needed out there. What do you think? Let me know if you think that that's a really good idea or if you think it's dumb. I'm open. If you think it's dumb, you can tell me. I'm not going to be offended. Alrighty. So infection control education for the beauty industry, that's my specialty. And I have passion for it. I've been in the industry a very long time, and I know that we have a strong need for it. And I think ongoing support and hand-holding and peer support, because we can all help each other. And I'll let you know. So we have your email. I'll chat with Chrissy about this, see what she thinks, talk to some of our veteran attendees and see what they think. And if we go forward with it, I'll let you know. Alrighty? Okay, everyone. Next webinar, which is on November 10th, I believe. Let me just double check here. So I'm going to move this. Yep, November 10th, same time, is how to create a bloodborne pathogen exposure control plan. So it's a little more in depth than today. It's got some really good information in it. I have some documents to send to you that will help you through this. It's going to partner up with the risk assessment webinar that we took last time. And of course, any questions, we're here. Alrighty? All right, everyone. Take care. Have a wonderful, wonderful day. Bye.